Hi, I'm Dr. Len Saputo, and I'm here with Dr. Meir Schneider. Dr. Schneider is a licensed massage therapist, has an honorary degree, PhD in healing arts, and he's the founder of the Self-Healing Research Center, as well as the School for Self-Healing in San Francisco. He's the author of many books, the two most famous, Movement for Self-Healing, and now his new book, Vision for Life. He's also an international lecturer and instructor. This book that you've written is a really remarkable book, is a practical book, and it has 10 steps for natural eyesight improvement. What was it that led you, Meir, to write this book? Why do we need it?
Today, people's vision have deteriorated beyond belief. And the problem that I have is that your profession, the medical profession, does not have any answer to it. What happened is that in the last 10 years, people see worse than they saw the 100 years before. In the last 2 years, people see worse than they saw the 2 years before.
So it's really getting worse at a quick rate. And
Absolutely.
how's it getting worse?
Because we look from near a lot, because of computer use. I think that many eye problems started with literacy. You know, Dr. Bates, who invented vision improvement, was very upset over the fact that in upstate New York, as many as 6% of the children in elementary school became nearsighted. It used to be 2%. So he saw it as a myopic epidemic, nearsightedness epidemic. Today, 52% of kids in school are nearsighted.
That's just hard to believe.
Unbelievable. Unbelievable. Used to be that kids would be called glasses or four eyes.
Four eyes, yeah.
Not today. I mean, it's so normal.
Right, everybody be calling themselves four eyes.
Exactly. So what happens is we look from near and we don't look far enough. What happens is we don't use our periphery. And that is after for a million years, our ancestors worked so hard to use the periphery.
They had to, didn't they? Because they were hunters.
Exactly.
And if they didn't do that, then there would be no chance that they would be able to hunt successfully.
But be a chance to be hunted.
To be hunted. So maybe there has been not enough time for the human being's eye to adapt to this change, because it's been just 100 years or so.
Absolutely. You know, even in the time of the 1800s, people used to read much less. I mean, books were pre-ordered. I mean, they did not have a thing like a publisher prints a book and then can print more books and all that.
You get them in 2 weeks, right?
Yeah, that did not happen. So these days, when you have basically dozens of millions of books, and that means many, many readers, but when you have a situation where people surf the net at home, but before that they work 8 hours on their computer, and they look at pixels that don't have margins. And so they strain their eyes without even knowing they're straining their eyes, and they don't have any sense of the periphery. They don't look at a distance. That causes the problem. That's why I've written my book, Vision for Life. There are 10 simple steps that you can take to adapt to modern living.
So are you teaching them exercises so that there's basically this atrophy that they have, where they lose the ability to see in the periphery and they lose the ability to focus carefully? You can do something about with some of your steps in this book?
Exactly. And I think that here is the most important point. Sorry about that. The medical profession does not give you any way out of the problem. As soon as you see 95% of normal vision, 20/25, guess what? Get glasses.
Yeah, right.
And the moment that you are having any pathological problem, get drugs, get a surgery.
So it doesn't give the body a chance to adapt itself in a natural way, which is really what your book is about, is how to self-heal.
Exactly. Think about it. In the 60s, if you would tell anyone that diet and exercise can help hearts, they would laugh at you.
You would believe this, Meir, but in the 60s, they told us that by the time we got to be 40, that we shouldn't exercise anymore and everybody should have an EKG because they probably had heart disease. That was done by proclamation and fear. And today, what do? It's quite the opposite. It's about exercise and diet and all these other lifestyle things.
So now ophthalmologists tell you this: your eyes are weak. Here are your crutches, your glasses.
That's right.
Ophthalmologists tell you, oh, you have eye pressure? Here are drops.
Yeah.
You have cataract? We'll remove it.
Yeah.
Don't think that actually removing cataract heals the eye. It fixes the situation. Just like if you have a tooth that is rotting, and after the second root canal it doesn't work, they'll extract the tooth and put an implant instead. Well, fine, they fixed the situation. They didn't cure you.
They didn't solve the problem that was underlying.
Exactly. So what we need to do is take the steps of relaxing the eyes, adjusting the eyes to light, working with the periphery of our vision, looking at a distance. All that will make a very big difference. And I just wanted to say that now in Israel, there was a physician that got a 15-year-old girl who came to him, and the parents wanted him to fit her glasses. Now, he was a very alert physician, and he said, after every half hour that you use the computer, go play. She did not need the glasses. That's so important. We don't understand the need for the outdoors. We escape the outdoors.
Can you think of an example of someone that you have treated that has had a dramatic change in their vision because of the exercises you have? Say someone who really could hardly see.
You know, there was a wonderful lady by the name of Simone, and she is a practicing dentist and also a professor of dentistry. And she drove in a road at night for vacation in Brazil, and a truck drove in her lane without its lights on, and she couldn't swerve in the last minute, and there was a terrible accident, and her skull broke. And the doctors did a very good job in putting the bones back together, but she lost 100% of her vision in her right eye to the point of not seeing light, and 97% of her vision in her left eye.
Wow.
So she came to my 6-day eye class in São Paulo, Brazil, and then I worked with her. It was really devastating to see a woman that had completely good vision, seeing next to nothing on the eye chart. And I worked with her, and what was interesting is that I would patch her left eye, that was the sighted eye, and she wouldn't see light in the dark. But in the sun, if I would put a paper, and I don't understand why, blue or yellow, I would move it away, she wouldn't know that I put the reflecting paper from the sun in front of her, but she senses something changed when I move it away. I am the only one who called that vision. After the first session that we had, she started to be able to grab that paper for me, and we started to do karate fights. Every time she did it, she started to see better with the left eye. That's because pressure was taken away from the left eye by the right eye seeing something. She came to San Francisco, worked with me for an intensive week, came back to Brazil, and I came back to Brazil a few months later. She saw 20/30
Oh my
with
goodness.
her left eye. I couldn't believe it. I would have been happy if she would have seen 7%.
Oh yeah.
She saw 20/30, 90% of 20/20. Right now her vision is 97% in the left eye. She starts to see shapes with her right eye. And last time I actually called her because I wanted to ask her if to do a root canal in my teeth or not. And she told me, Meir, you gave me my life back.
That's great.
And she said, I drive, I teach dentistry, and I'm proud that none of the kids that I work with, she's a pediatric dentist, has any cavities, and I don't even use special instrument. I just use regular dental instruments to work with. That's the best case I had lately.
Meir, that's a great story. And I just want you all to know this is a wonderful book that's practical. It'll give you 10 easy ways to learn about what you can do for your own eyes and for the eyes of your family and your friends so that you don't deteriorate like so many eyes are, and also be able to see the best you can yourself. Thanks so much, Meir.
Thank you, Len. Thank you so much. And thank anyone who watches this show. Please, please help us create a new important silent revolution. You can see better and you should work on it.
Okay.